Neonatal sepsis. What is neonatal sepsis? Neonatal sepsis is the term that has been used to describe as the systemic inflammatory response syndrome resulting from a suspected or proven infection in the first month of life. What is the clinical feature of neonatal sepsis? The clinical features are mostly non-specific. Not feeding well or refusing to suck, the baby may be less alert or less active. The baby may have lethargy and poor muscle tone and poor cry. The baby may have low body temperature or fever. Vomiting can be present and movement occurs only when stimulated or no movement at all. There are some specific clinical features too, like is in meningitis, the central nervous system is affected and the symptoms of following can be found. The baby will be irritable. He or she may have full fontanelle, have seizure, vacant stare, high-pitched cry, neck retraction, etc. may be present. If gastrointestinal system is affected, then feeding intolerance, vomiting, diarrhea, abdominal distension, paralytic ileus, and necrotizing enterocolitis are found. When respiratory system is affected, then grunting, which means making animal-like sound, then apnea, irregular breathing, fast breathing, severe chest indrawing or cyanosis may be present. When cardiovascular system is affected, then bradycardia, tachycardia, hypotension, poor perfusion and shock may be present. Skin changes may occur. Then sclerema, which means diffuse hardening of soft cutaneous tissue, multiple pustules, periumbilical redness or foul smelling umbilical discharge may be found. Hematological changes may occur which may result in bleeding, pateshi, purpura and jaundice. Urinary symptoms may be oliguria and anuria. And primitive reflex can be absent or diminished. To investigate neonatal sepsis, we have to do sepsis screening by doing total leukocyte count, which may be less than 5,000 per cubic millimeter. Absolute neutrophil count will be low. Immature to total neutrophil I by T ratio will be more than 0.2. C-reactive protein is positive. Micro ESR is more than 15 mm in first hour. Elevated heptoglobin more than 1 mg per deciliter. Other investigations include complete blood count with peripheral blood film, blood for culture sensitivity, then blood for procalcitonin, which may be raised, CSF or cerebrospinal fluid study, urine for routine and microscopic examination, and culture sensitivity is done. Then X-ray chest and X-ray of abdomen is done. Treatment of neonatal sepsis. The treatment options are supportive care. The temperature of the baby should be maintained by maintaining optimum room temperature, more than 25 degrees Celsius, then wrapping and warming in radiant warmer or incubator. Hypoglycemia can be corrected by 10% dextrose. The baby should be breastfed. If not possible, then nasogastric feeding of expressed breast milk should be done. If the baby cannot tolerate oral or nasogastric feeding, then IV fluid 20% less than normal daily allowance should be given. Treatment of shock is done by dopamine or dobutamine along with volume expander, normal saline, albumin, blood. In case of DIC or disseminated intravascular coagulation, fresh frozen plasma, vitamin K, platelet infusion, exchange transfusion is done. Hypoxia is assessed by pulse oximetry and oxygen therapy or ventilator support is initiated. Seizure is controlled by appropriate medication. SIDADH or syndrome of inappropriate antidiuretic hormone is monitored by urine output, hyponatremia, serum and urinary osmolarity. Then metabolic acidosis should be treated with bicarbonate and fluid replacement. The care of umbilicus should be done. Then antimicrobial therapy is given. Empirical therapy is given by ampicillin plus gentamicin or ampicillin plus cefotoxim is given. Duration of antibiotic therapy is usually 7 to 10 days or at least 5 to 7 days after a clinical response has occurred. For meningitis, gram-positive bacteria, in case of gram-positive bacteria, we have to continue the antimicrobial therapy for 14 days, and in case of gram-negative bacteria, it is done for 21 days. Host defense modulation is done by granulocyte transfusion and immunotherapy. Follow-up is done every 4 to 6 hourly to monitor the vital signs, which are heart rate, respiratory rate, temperature. Then primitive reflex such as suckling, rooting, Moro reflex and others are checked. Skin conditions such as texture, color condition, tissue perfusion and any mottling is examined. Anterior fontanelle is seen to check any bulging or fullness. Then abdomen is examined to see if any distension is present or there is presence of bowel sound and passage of urine or stool. Any untoward sign like convulsion, apnea and cyanosis etc. are observed.